There is a rise of heart attacks across the country.
There is nothing like a sudden cardiac arrest today.
Okay.
These people who had a sudden cardiac arrest had a disease before which was not detected.
Is there a calorie deficit that you need to have? Or?
No, let's not complicate it.
Okay.
Rice, chapati and sugar. These three things you have to eat as less as possible. Your meal should be mainly vegetables and protein like fish, chicken or whatever you like to eat.
Narayana Health. This institution was formed by you. Discussing with the patients, you said them, don't worry about the money. I'll take care about it. How are you doing this, sir?
Healthcare is predominantly a volume game.
Okay.
About 16% of the heart surgery done in India is done by us.
What are the three main lifestyle changes, if you can say?
I recommend every Indian to wear a smartwatch, irrespective of your age.
Okay.
And also, everyone should count the number of steps they walk.
Every 33 seconds, somewhere in India, our heart stops beating. Cardiovascular diseases have become our nation's #1 killer, taking nearly 1/3 of all lives and alarmingly striking younger and younger Indians. In a time where fitness trackers, diet plans, and wellness trends flood our lives, why are heart attacks still taking us by surprise? To help us decode this crisis and offer a ray of hope, we are joined by a man whose name is synonymous with healing hearts. Dr. Devi Shetty, globally renowned cardiac surgeon, founder of Narayana Health, and architect of a revolutionary model that delivers world-class treatment at a cost within a reach of millions. Over 1.2 lakh heart surgeries, countless children and underserved patients saved. Honored with the Padma Bhushan and Padma Shri, Dr. Shetty is not just a doctor, he's a reformer, a visionary. In this episode, we ask, what's really behind the sudden surge in heart attacks? How can we protect ourselves and our loved ones? And what does it take to reimagine healthcare for 1 billion people? Stay with us as we go heart to heart with the man who's saving millions of them. This is HP Unplugged. Hello everyone and welcome to this special episode of HP Unplugged where we have with us Dr. Devi Shetty. It is an extreme pleasure for us, sir, that you have agreed to come for this interview. And we are truly privileged that you are giving your valuable time, the time of the patients that you are looking into, to us for this very knowledgeable session that you are going to have with us.
Thank you so much. It's my privilege.
Sir, as the first question that I wanted to ask you is, there is a very growing concern now amongst all the Indians and especially in Indians, the young Indians, that seemingly fit Indians, young Indians are having heart attacks, are having cardiac arrest, and there is a rise of heart attacks across the country. What are the early signs which we can see and take care so that we know that we will not fall for heart attacks like that? Can you explain, sir?
More than the signs and symptoms, what's important is every time you see the TV that some young fit person or a professional footballer, somebody had a sudden cardiac arrest.
Yes.
If all these people who died suddenly, so-called sudden cardiac arrest,
Okay.
10 years earlier, if they went for a checkup, basic tests like a blood test, echo, ECG, and a CT scan of the heart.
Okay.
That's
CT scan
all.
of the heart. Okay.
If they had it 10 years earlier, this death could have been anticipated and prevented.
Okay.
Without an exception.
So, like all.
Yes.
Okay.
There is nothing like a sudden cardiac arrest today.
Okay.
These people who had a sudden cardiac arrest had a disease before which was not detected, because people do not know that how fit they feel has nothing to do with how fit they are.
Okay.
If you are waiting for symptoms to happen for the heart problem to be treated, it's too late. You already missed the bus.
Okay.
You should detect the disease when the symptoms are not there.
Symptoms are not there.
Not there. Every Indian at the age of 18 must have a blood test done
Okay.
for an abnormal lipid profile. And by the age of 20-25, they should have all these routine tests.
Okay.
And once in 2 years or whatever is possible, you have to get the test done. Then none of those problems would have happened.
So, sir, just a connection between the lipid profile and heart attacks. Like, so cholesterol is a reason for the blockages that are happening. So what is the lifestyle change one should have in their? What are the three main lifestyle changes, if you can say, to prevent like having this kind of a disease?
I recommend every Indian to wear a smartwatch, irrespective of your age.
Okay.
Because many things in healthcare will be detected with a smartwatch. People should get used to the smartwatch.
Okay.
And also, everyone should count the number of steps they walk.
Okay.
If you walk 10,000 steps every day, your chances of developing a cardiac problem, your chance of developing Alzheimer's, joint problems, cancer, a lot of the diseases, incidence is significantly lower if you walk 10,000 steps per day.
10,000 steps per day.
And it's not difficult. All you have to do is to be conscious. If you're on a mobile call, there is no need for you to sit. You can walk around when you're talking. So easily you can add 1,000, 2,000 steps. So being active is the best thing you can do to your life. And of course, if you are a diabetic, diabetes has to be controlled, hypertension has to be controlled. And a lot of the time, when people who are slightly obese, if they lose weight, blood sugar comes to normal level without medicine, blood pressure comes to normal level without medicine.
Okay. Okay. So basically, watching the weight and what you eat and taking steps.
Yes.
So coming to what you eat, like is there a calorie deficit that you need to have? Or?
No, let's not complicate it.
Okay.
Rice, chapati and sugar. These three things you have to eat as less as possible. Your meal should be mainly vegetables and protein like fish, chicken or whatever you like to eat.
Okay.
All along in the history of modern healthcare, we blame the oil for the mischief played by the carbohydrate.
Yeah, okay.
Right? The real culprit, villain, is the carbohydrate. That is rice, chapati and sugar. If you can control this, battle is won. Yes.
There are so many influencers nowadays on Instagram and everywhere, and they give so many tips, and it's very confusing for the person to understand. They tell about take this supplement, take that supplement, Then some articles say that egg yolk is good, some articles say that egg yolk is bad. So, it's very confusing. So, what is your take on that?
My advice is everything is okay in moderation. Don't take anything in excess. Mind the sugar.
Okay.
Exercise. That's all.
And take tests.
Yes. Every year or at least once in 2 years, go for the preventive checkup. 60 minutes, 90 minutes, you can get all the tests done. Yeah.
We knew these tests needs to be done, but first time I am hearing that CT of heart to understand the blockages that are there.
Yes. You see, the 33% of the deaths are due to cardiovascular disease.
All over
the world.
Okay.
Mainly in India. 17% of the deaths are due to cancer.
Okay.
Heart and cancer is responsible for 50% of the deaths, mainly premature deaths.
Okay.
People die before the age of 70.
Yeah, 20 to 50 people are dying.
Yeah. I'll just give you the scenario in India.
Yeah.
Every day before 7 o'clock in the evening, every day, few thousand people across the country will develop heart attack.
Okay.
And 10% of them will die.
That's alarming numbers.
Every day before 7 o'clock in the evening, few thousand people will be told that they have advanced cancer for which there is no cure.
Okay.
And they are going to die.
Okay.
Just go back 365 days, 1 year earlier. If all those people went for a preventive checkup where they got the blood test done, echo, ECG, ultrasound, CT scan of the chest and the abdomen, everything is done. It can be done within 60 to 90 minutes. None of them would have developed the heart attack.
Okay.
Because heart disease would have been diagnosed, they would have been treated. None of them will be diagnosed with end-stage cancer.
Cancer can also be detected by these tests?
We can detect it 1 year early.
1 year early.
Okay. And if they had a cancer, it will be early stage cancer, and most early stage cancers can be cured by a simple treatment. Right? That means 50% of the deaths can be prevented
Okay.
by health checkup.
Just by health checkup.
Just by health checkup. Why this is happening today is because 20-25 years ago, we didn't have those smart scans.
Correct.
We didn't have half the tools what we have.
Technology.
Today we have amazing tools.
Yeah.
But the problem is, everyone feels that they are fit because they can run a marathon, but you can run a marathon, but next day you can drop down dead. So essentially, everyone must know that how fit they feel has nothing to do
with how fit they are.
That
That's the punchline that I'm going to carry, and it's very, very important what you focused on, and I hope all the viewers who are listening to this podcast will definitely start taking this seriously, and they will do the tests every year. Sir, the next question that I want to ask is about Narayana Health. This institution was formed by you, and we call it the Walmart of world-class healthcare. I just witnessed in front of me that you were discussing with the patients. You said them, don't worry about the money, I'll take care about it. So how are you doing this, like low-cost, world-class quality healthcare? Because I visited this facility and it's so high-tech, and you are doing it in low-cost. So this is something that all the hospitals across the world, and especially in India, they can learn from. So what is your take? How are you doing this, sir?
See, the healthcare is predominantly a volume game.
Okay.
About 16% of the heart surgery done in India is done by us.
Okay,
So
16%.
16%.
That's a huge number.
Yes.
Across India, you are doing
across
that.
India, yes.
Okay.
Yes, yeah. So as we do more operations, our results get better.
Okay.
And our cost goes down. Okay. And the infrastructure gets utilized.
Okay.
I just want not talk about just India. I just want to talk about. I can tell you that India will become the first country in the world to dissociate healthcare from wealth.
Okay.
India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy. And India will do it within the next 8 to 10 years' time.
All right. So that is a revolution in itself.
Yes. India will prove to the world. Now, why India can do it, why other countries can do it? Last Independence Day, Republic Day speech, our Prime Minister committed that we are adding 75,000 additional medical seats.
Okay.
Is there a single country in the world where the Prime Minister can say that I'm adding 70 or 75,000 additional medical seats? Over and above 110,000 seats what we have.
Okay.
No country can do it.
No country can do it.
We can do it like this. We produce the largest number of doctors in the world. We produce the largest number of nurses in the world, technicians in the world. We are the pharmacy for the world.
Okay. We produce the largest number of drugs.
We produce the largest number in terms of quantity. We produce the largest amount of medicines in the world. We have everything going. But our missing link is people don't have the money to pay for the healthcare. Now that is being addressed again by the progressive policies of the government.
Okay.
Now, today a hospital group like ours can become a health insurance company.
Okay.
And we have become a health insurance company.
How?
Because the IRDA gave us the license.
Okay.
The advantage of hospital becoming a health insurance company is a game changer.
Okay.
The reason is, today when I tell a patient that you need a bypass grafting, first thing what goes to your mind is it really required?
Required, yeah. Will I be able to afford?
Yeah. Now, when I become a health insurance company, you are a subscriber to my insurance.
Right.
When I tell you that you need a bypass grafting, there is no conflict because I am going to pay for the surgery. Then my interest and your interest is aligned. That's one thing. And secondly, today, as more people develop heart attack, it is better for my business. But when I become a health insurance company, I will work very, very hard to make sure that you don't develop the heart attack. I will screen everybody, I'll make sure the diabetes is controlled and everything is, because you don't develop a heart attack.
You are walking, you are doing
Exactly.
everything properly.
Yes, yes. So the essentially the first insurance policy we are launching now, we want maids and gig workers to be covered by health insurance.
Okay.
We are launching a product.
Okay.
We want all the maids and the gig workers should be covered for any type of surgeries.
Okay.
Up to 1 crore rupees.
Up to 1 crore
Maid
rupees.
and the children.
Okay.
1 crore rupees.
And how are they going to
medical
pay?
treatment, if they require a medical treatment, up to 3 lakh rupees.
Okay.
And the premium is 7,000 rupees.
Okay.
Yeah.
With that, you will be. That's a huge number because the
That is
maids and the.
possible. That is possible.
Okay.
So essentially, in this country, this is an amazing country because of our volume. Any of those schemes will become viable.
Okay.
Like some of the richest countries in the world, lot of people don't have data in their phone because it's too expensive. But in our country,
Everybody
even
has.
the beggars have mobile data.
Correct.
How it was possible? Because we are 1.4 billion people. That is our strength.
And
When
power of-
millions of people contribute to the insurance, the premium will go down.
Okay. So, suppose we were discussing earlier about the gig workers. So, about people contributing
Yes.
for their insurance. So,
Yes.
can you throw some light on
See,
that?
there is a discussion going on in the policy. I'm sure it will happen. There is something called health savings account,
Okay.
which started in Singapore many, many years ago.
Okay.
And now it's very popular in US. About 34 million people in US have health savings account. It's
Right.
nothing but a simple bank account. But the money deposited there can be used only for the purpose of buying the health insurance
Right.
or paying for your healthcare expenses.
Okay.
So, like gig workers, they have no health insurance. Supposing there is a health saving account in their name, and all the apps we place order food and ice cream at 2 o'clock at night, somebody, one poor chap comes with a ice cream for you and your children,
Right.
you are happy with the service.
Correct.
So there should be an option to contribute 50 rupees or 100 rupees to the health saving account.
Oh, nice. Instead of giving a tip to him,
Exactly.
we are contributing to his,
Yes.
which is for his health and for his family's health.
Yes.
That's a beautiful idea.
This will happen. I am convinced it will happen.
Okay. Thank you, sir, for giving us this idea about how this healthcare insurance scheme that you are going to come up with is going to work. You answered one of the questions that I was going to ask is, you have made cardiac care accessible to the common public, the general public, because I saw people coming to you who have no financial support, and you telling them that don't worry, I'll take care of them. So that was.
I just want to know how much the cost of heart surgery has come down. I left England in 1989.
Okay.
And I came back to India. I settled down in Calcutta.
Yeah.
And the first patient I operated about 37 years ago paid 1,60,000 rupees for a bypass graft.
At that time.
That is 36 or 37 years ago.
Years ago.
Today people are paying less than that.
Wow. After the inflation of 36 years.
Exactly. Tell me what was costing 1,60,000. Today
100
when
times
people
almost.
complain
Yeah.
that cost of healthcare has gone up,
Okay.
I just want to remind them what it was then. But the irony is, even if I reduce the cost of a heart operation to 70,000 rupees,
Okay.
half the country's population cannot afford it.
Right.
Now what do you do for them? By themselves they can't.
Okay.
But if there is an affordable health insurance, they can.
They can.
See why I decided to become a health insurance company. I have seen in the last 10 years, there has been significant prosperity in India. Earlier, whenever I used to tell patients that you need a heart operation, they had only one question: how much it is going to cost? If I tell them it costs 2 lakh, 3 lakh rupees, they used to cry, beg, and it is very humiliating experience I went through. But last 7-8 years,
Okay.
they cry, they beg and say that we can't afford 3 lakh rupees. But before they leave the office, they will invariably say, "Ami 1 lakh dete paru.
Okay.
I can give you 1 lakh rupees."
1 lakh rupees.
A lady who comes from a slum is today come up with 1 lakh rupees to save her child's life.
Child's life.
That made me to think that if I have a health insurance
Correct.
with a premium of 7,000 or 10,000 rupees per year to cover her whole family, this lady today has enough money to cover her entire family for the next 10 years.
10 years. Okay.
But the insurance doesn't exist.
Okay.
She can't create the insurance, we can.
Yes.
This is the power we all enjoy in this country because the right policies by the government and the wealth the country is creating. Yeah.
So, sir, one question that is coming to my mind here is how are you going to take this message of health insurance to the common public to make them understand that this is beneficial to them? How are you going to educate them to take this policy?
The greatest problem in health insurance is convincing people,
Right, that's what.
especially working class people,
Correct.
about the benefit of health insurance. It's going to take a long time. I just want to remind you about the history of our experience in taking care of the working class people.
Okay.
Around 22 years ago, there was 3 years of consecutive 3 years of drought in Karnataka state.
Okay.
Our farmers lost the capacity to pay for the health care.
Okay.
At that time, we came up with a concept of micro health insurance called Yashaswini.
Yashaswini, yeah.
Yeah, it was launched in Karnataka
Karnataka.
state.
Okay.
The insurance is about all the farmers paying 5 rupees per month.
Okay.
That's the price of one packet of BD. They
Yeah.
smoke, right? 5 rupees per month.
Okay.
And government agreed to become a reinsurer.
Okay.
And we network with 600 hospitals across the state. And the insurance is only for surgeries. We ran it for 12 years. At the end of 12 years, 1.4 million farmers had varieties of surgeries.
All right.
And 1,30,000 or 1,50,000 farmers had a cardiac procedure.
That's huge numbers.
All by paying 5 rupees per month. Because 4.5 million farmers agreed to pay 5 rupees per month.
So because of the numbers.
Exactly. This is our strength.
This is your strength.
Yeah, that's why I am confident that we will change all the rules of the game. All along, when I was growing up as a kid, everybody told me that healthcare is expensive, it will remain expensive. But one day, India will become a rich country and everyone can afford. And we believed them.
Okay.
But when I grew up, I looked at the richest country in the world called America, struggling to offer healthcare to the citizens.
Okay.
That means India becoming a rich country will not get translated into affordable healthcare to everyone. We have to change the rules of the game. And this is what we are trying to do.
That's good to hear, sir, what you are trying to achieve here. And we wish you the best that you can do it and we all can contribute towards it. Sir, now I come to the question. We are in Bengaluru, which is a city of technology, digital technology and IT. So, what is the role of AI and digital in healthcare now, in terms of surgery and patient care? How are you integrating technology?
AI and digital platforms are going to dramatically change the way healthcare is delivered.
Okay.
We have been investing millions and millions of dollars for the last 20 years in developing the platform. We have a very advanced digital platform supported by AI. So our reception, the entire hospitals are virtually paperless.
Okay.
And our patients don't get the report with the paper, it all goes to their phone.
Okay.
And it's a very mature platform. And unfortunately, 80% of the hospitals across the world don't have a basic digital platform. This is the problem in using AI. But that is going to change in India.
Okay.
Because we have started giving our digital platform called Atma and Meda free of cost to charitable organizations.
Atma
and Meda.
Okay.
This is the digital platform we created.
Okay. This is created by Narayana Health.
Narayana, yes.
Okay.
We have 250 software engineers.
All right.
Who are built this for so many years.
Okay.
It takes a long time. Essentially, we have the country is very privileged to be having extremely smart software engineers.
Yes, correct.
So we have started. Sai Baba's hospital in Bangalore is using our software.
Okay.
There is a hospital called Skada Memorial Hospital in Madras, a charitable hospital. They are using our software. Why I feel India will transform, digital transformation of healthcare will happen in India is we gave our software free of cost to charitable hospitals because they don't make that kind of money. 6 months after we gave the software to these hospitals, their entire patient experience changed. Patients, there is no queue outside the hospital. Patients can register themselves, pay online, everything changed. So the CEO of the Skada Memorial Hospital, one day he visited me and he asked me why I agreed to give them our software free of cost. I told him that if I ask you to pay money, you don't have the money to pay, so you wouldn't take it, so I gave you. But I said, let me ask you a question. By giving you my digital platform EMR software free of cost, have I become poorer? No, I haven't become poorer. Then I asked him another question. If I didn't give you my digital platform EMR, will I become wealthier? No. This is the beauty of converting atoms into bytes.
Okay. That's very nice thinking.
We can give our EMR free of cost to the whole world. Still we will have what we have.
Correct.
Yeah. This is how India will transform every aspect of healthcare.
I hope what thinking and philosophy that you have, it's translated across India, translated across hospitals, and they also adopt the kind of thinking that you are trying to achieve and for this country, for our country. Sir, I want to now discuss more about your personality, your career and your journey. You said you did, in 1989, you did FRCS from London, then you came to India, you served in Kolkata, then you founded this and you did the first neonatal surgery of India. So, what were the pivotal moments in your career from which a young doctor or a young leader, maybe in business, can get inspired from?
See, the advice I have for the younger generation, especially those who want to change the world and want to do something worthwhile, always look at a business opportunity in addressing the problems of the working class and poor.
Okay.
If you can master solving that problem, in the end you will end up getting the rich people business as well.
Okay.
But if you go after the rich people, they can always run much faster than you.
Okay.
Yeah. This is my advice.
This is your philosophy.
Philosophy.
Beautiful.
Always take care of there are enough people catering to the rich people.
Right.
Yeah. But the real business opportunity in giving what the rich people have to the working class and poor people using your business sense. We understand money is like oxygen.
Right.
Without oxygen, we can't live for more than 3 minutes. But purpose of life cannot be oxygen. There is something else.
There's something else.
Yeah.
Thank you, sir. And that's it for today's interview. I hope all the viewers who are listening us from across the world in the podcast will be truly benefited with this. We are truly honored to have you here, sir.
My privilege.
Dr. Shetty, thank you for sharing your wisdom, your journey, and your vision for a healthier India. Your work reminds us that saving lives is as much about hope as it is about medicine. To our viewers, if this conversation helped you see heart health differently, share it with someone you care about. Awareness can save lives. This is HP Unplugged. Stay informed, stay inspired, and stay heart healthy.